Welcome, everybody. Thank you for joining us. Today, we will be walking you through the COVID-19 decision guide. It's a guide for responding to symptoms and exposures on campus. We've just updated this material on September 8th. My name is Bob Mueller. I'm serving as our duty officer for our COVID-19 incident, and I'm joined today by Corinne McCarthy, our program specialist for school nursing.
Hello, everyone.
So I want to start off by saying that Corinne and I didn't just get together one day and make this stuff up. All of the information I'm about to present to you comes from either the Center for Disease Control, the California Department of Public Health, or our local public health agency. It's also important that we're going to share some tools with you during the course of this presentation. You should check back to the web page that you link to see this presentation at least once a week to see if there have been any updates. The CDC and World Health Organization, Department of Public Health are still learning about this virus, so the information evolves, the guidance changes, and we'll update it as soon as it's available. The decision tree, the COVID-19 decision tree, was a collaborative effort between SDCOE and San Diego County Health and Human Services Public Health Services Division. Their doctors and nurses in epidemiology worked with us to try to craft this decision tree. This presentation is based on what you see in the tree, but we've extended it a little bit further. It's really useful information for responding to symptoms or exposures right now, but it doesn't address communication, the instructions you would give individuals, the notifications you would need to make, or the follow-up actions. So we created the decision guide as a companion to the decision tree. It includes everything that's in the decision tree, but it also presents that information using scenarios. It gives guidance on administrative actions and decisions that need to happen. And then it's followed up with some frequently asked questions that will probably be helpful for you. So before we go deeper into the presentation, I want to go over some abbreviations that we're going to use a lot. So C19 means COVID-19. C19 plus would be a person who's been diagnosed as having COVID-19. Either they've had a lab test that came back positive, or a physician or public health official informed them that they're presumed to have COVID-19 based on their symptoms and that they are not going to be tested. A person who is symptomatic has symptoms associated with COVID-19. We don't know whether or not they have it necessarily, but if they're symptomatic, they have some of those symptoms, one or more of those symptoms. An asymptomatic individual is a person who's tested positive for COVID-19, but who isn't showing symptoms. A pre-symptomatic person is a person that, well, has COVID-19. And what we want to say about that is everyone who has COVID-19 is pre-symptomatic 2 days before they're contagious, and they're pre-symptomatic. Let me say it differently. They are contagious 2 days before they begin showing symptoms. So they're pre-symptomatic during those first 2 days. A close contact is somebody who has been within 6 feet of an individual that's been diagnosed with COVID-19 for 15 minutes or more, whether they're wearing a face cover or not. And we assume that every member of a household, anyone who lives with somebody who has COVID-19, is considered to be a close contact. Quarantine is for people who have had close contact. Those people must quarantine for 14 days to see if they develop symptoms. And then if they do develop symptoms, they would be required to self-isolate. So people who are showing symptoms must self-isolate at home for days. And we're going to go deeper into that. Yes, if they have symptoms, or if and they will also self-isolate if they've been diagnosed or they've tested positive for COVID-19 and they are not showing symptoms yet. So I always like it when I get the answers before I take the test. So we're just going to give you this right out front. How long do people need to stay away from work or school due to COVID-19 symptoms or exposures? So to understand this, there are really two groups of people. There are people who have symptoms and there are people who don't have symptoms. So if someone has symptoms, they're going to be eligible to return after they meet the criteria in either column A or column B. So column A, they can return after a minimum of 10 days have passed since they began symptoms and their symptoms are improving and they've been free of fever without using fever reducing medication for the last 24 hours before their return. And we want to note here that this includes all people, even people who are positively identified as having COVID-19 can return using these criteria. The other group of people in column B, some people after developing symptoms will go take a test. And if they were tested using the PCR COVID viral test, they can return 72 hours after all of their symptoms have fully resolved. It's important to note that there are many kinds of tests, and our public health department has told us only the PCR viral test can be used for this purpose. Some of the people who, some people who test positive, some people who test negative, their symptoms may hang around for a while. Whenever I get a cold, I've got a cold for 14 days. My symptoms are going to be there for a long time. So I might test negative. It's clear I have a cold, not COVID-19, but I wouldn't be able to return under these criteria because my symptoms are going to persist for so long that I'm better off returning in column A. So either criteria work. And if column B is just going to take too long, then if it's been longer than 10 days, my symptoms are improving, and during the last 24 hours before my return, I didn't use fever reducing medication and did not have a fever, I can return. The second group of people are people who have not developed symptoms. These would include people who have been in close contact with somebody who has COVID-19 or individuals who've tested positive for COVID-19 and who are asymptomatic. So in column C, people who are close contacts can return 14 days after their last contact with the person who was infectious, as long as they don't develop symptoms during that time. If they develop symptoms, then you're going to use the criteria in column A. Once they develop symptoms, they have to go 10 days from the date their symptoms started. Their symptoms have to be improving, and during the 24 hours before their return, they must not have a fever or use fever reducing medication. The other set of individuals, people who have been tested positive for COVID-19 who are asymptomatic, those people, if they never develop symptoms, can return to work or school 10 days after the date of their first positive test. However, if they do develop symptoms during that 10-day period, then we're going to use column A for their return as well. They're going to have to wait 10 days past their first date of symptoms. Their symptoms must be improving, and during the 24 hours before they return, they have to be fever-free without the use of fever-reducing medication. Corinne, did I miss anything? Anything you want to add?
I think that sounds great, Bob. I might want to just say one more thing, and that is if you notice in any of these columns, there is not anything that says someone needs a repeat test. So we've moved away from getting repeat tests. If they get a negative, they need a positive. So we don't need to do that anymore. What we're basing all these criteria on are symptoms and time factors. So that's where we're going with that. So please, don't think that you have to request folks to take multiple tests. They don't any longer. That's it.
So I know there are a million what ifs, and you've probably been hit with a ton of them. But when we really look closely, there are only 3 scenarios that schools need to be concerned about. A student or staff member or visitor on the campus either has symptoms, or they've been in close contact with someone who's been identified as having COVID-19, or they themselves have COVID-19 and there could be close contacts on the campus with them that we need to be concerned about. All the other scenarios, my wife works with someone who's being tested for COVID-19, can I still come to work? All those other scenarios don't matter unless they fit into one of these 3 categories. So let's go into those categories. The first one we're going to look at is a symptomatic student, staff member, or visitor. The first thing we want you to know is if you have somebody who has symptoms that the school is already aware of, that this person has a chronic pre-existing medical condition that causes the symptom, and that symptom hasn't changed in any way, its duration and intensity are consistent with what we see every year at this time, if it's an allergy or it's just consistent with the medical condition, and the parent says it's consistent and school staff know it to be consistent, then you can disregard that symptom. You don't need to exclude that person based on that symptom. So let's go into the table. And when you look at the document itself, the decision guide document is formatted exactly this way. So I'm just going to walk you through it. So the scenario is a student or staff member either exhibits COVID-19 symptoms, or they answer yes to a symptom screening question, or they have a temperature greater than 100 degrees Fahrenheit. And in San Diego County, 100 degrees Fahrenheit is the threshold. You may see 100.4 in other literature. Our public health officer, Dr. Wilma Wooten, has established 100 as the threshold in San Diego County. So the required actions, we're going to immediately have the symptomatic individual put on a face cover if they're not wearing one, as long as they can tolerate it, as long as they're able to breathe comfortably with that face cover on. We need to make sure they're wearing it. Isolate that individual until they're sent home. Anyone attending to that person should be wearing appropriate personal protective equipment. Ideally, that would be an N95 respirator that they have been medically cleared and fit tested to use, and gloves and potentially a gown while in contact with that infectious person. If you don't have an N95 respirator, or the person hasn't been medically cleared and fit tested to wear one, then a face cover and face shield warning combination, and try to maintain as much distance as you can between the student and the person that's attending to them. We're going to instruct that person when they're picked up, we're going to instruct them to isolate at home and contact their physician for more instructions. The physician will determine whether or not testing is necessary. We will not exclude other members of that person's cohort, whether classroom or workspace. We're not going to exclude those people until it's clear that this person either has COVID-19. Well, we won't exclude them unless this person has COVID-19. In terms of communication, we're going to provide self-isolation instructions. These are linked in the document. We're going to provide those to the symptomatic person. And we probably, at this point, notification won't be necessary. There's no protective action to take at this point, so no notification. In terms of return to work, the individual can return based on one of the following 3 criteria. It's been 10 days since the onset of the symptoms have improved, and the individual has been free of fever for the last 24 hours before their return, and they haven't used fever-reducing medication during that time. Or if they were tested and a PC COVID viral test showed that they were negative for COVID-19, they can return 3 days after all of their symptoms have fully resolved. Or if their symptoms are lingering, then they can return 10 days after their symptoms first appeared, as long as their symptoms are improving and they haven't used fever reducing meds or had a fever in the last 24 hours before their return. The other way that they could return is if a doctor, an MD, a DO, a nurse practitioner, a physician's assistant who manages a chronic condition for that person, if this would be in the case of a condition that's not already known by the school, if we get proof from a doctor that the person has a chronic condition that produces these symptoms, and they provide appropriate support for that position, and we get an authorization to have school staff speak to that provider, then that person may be readmitted to school based on the fact that their chronic condition is not COVID-19. I would add that a negative having another condition, flu, strep, or other condition, doesn't preclude the possibility that the person has COVID-19. So we're not allowing doctor's notes to simply return people to school where a doctor says he doesn't have COVID-19, let him back in. The only time a doctor's note is used for readmission back to school is when there's a chronic medical condition that the school wasn't already aware of, and we're determining that those symptoms that we're seeing are not they're not coming from COVID-19. Corinne, do you want to add anything on this?
You know, I would like to add a few things that have come up. So the temperature greater than 100, you know, if you get 100 or greater, I'd say send the child home or the staff member home. So when you hit 100, you know, that's our tipping point in San Diego County for sending folks home. The other thing I want to say is if a lot of questions have come up lately about siblings of students that are sent home with symptoms. And at this point, the only people that we need to send home to quarantine is those that have known close contact with a positive COVID-19. So until we know more, and Bob mentioned this, but until we know more about the symptoms and the condition of the person that we send home, we don't have to send home siblings necessarily or other people in the cohort, like Bob said. That's the letter of the law right now. Who knows if that will change, you know, in the future. And, you know, I can't stress enough another point that Bob said, and that is that we can't accept the letter from a doctor that says, I saw this patient, it's not COVID, I didn't test, but I know it's not COVID. Because there are so many conditions that could be in addition to COVID. So unless they've actually tested for COVID, we can't rule that out. And that's going to be important when flu season, the seasonal flu starts coming through San Diego.
The one other point I would mention is that a temperature of 100 or something really close to 100, a marginal reading like that, you would take the steps that we said, but you can recheck within a half hour. And if that fever is resolved,
Excellent.
then you wouldn't need to exclude that student. Is that correct, Corinne?
Excellent point, yes. And you recheck, obviously without giving any fever reducing medicine.
So the second scenario is a close contact with a COVID-19 positive. So we said earlier, close contact is generally defined as being within 6 feet of a person who has COVID-19 for 15 minutes. But that's more of a guideline. And really, when you get into contact tracing, public health services would help you identify who close contacts are. So in this scenario, a student or staff member lives with or has had close contact with a person who has tested positive for COVID-19 or who's presumed to have COVID-19. They've been advised by their doctor or maybe a public health official that they have COVID-19 and that they're not going to be tested, or they tested negative and are still believed to have COVID-19. The action is going to be that we're going to keep close contacts at home to quarantine for 14 days. We're going to instruct them to contact their healthcare provider for further instructions. That person will determine whether or not testing is necessary. We are not going to exclude others based on contacts with close contacts unless those people are later identified as having COVID-19. In terms of communication, we're going to provide them the quarantine instructions from public health. They are linked in the decision guide, so you can get a copy of them there. And then we're going to consider notification of the school of a potential C19 case. Chances are good that because we're starting to send people home, there'll be questions. So this kind of notification is meant to contain rumors and provide facts. Of course, we're also going to be very careful to protect the identity of anyone that's excluded for COVID-19 symptoms or quarantine. In terms of return to work, these people can return to work after 14 days from their last exposure to somebody who was infectious, as long as they don't develop symptoms during that time. If the person does develop symptoms during that time, then we're going to delay their return until 10 days past the beginning of their symptoms. As long as their symptoms are improving and they haven't had fever-reducing medication or a fever in the 24 hours before their return, they can come back. It's also important to note that a student or staff member has to continue in quarantine as long as there are people in their house who are still infectious. And then 14 days beyond that point to make sure that they don't themselves develop symptoms. One of the observations that we really want to, one of the points we really want to drive home for folks is we're going to be excluding kids from school for a really long time in some situations. If they have symptoms, it's going to be a minimum of 10 days. If they're a close contact, it could be 14 days and then they develop symptoms and it's 10 more days. Or if they're a member of a multi-person household and COVID is making its way through the house and they're one of the last people to catch it, they might be out for several weeks. So it's really important that we support students in these circumstances with excellent access to distance learning, ideally something synchronous that connects them to their regular teacher and classroom. It's also going to be really important that we come up with ways if they need their meal program through school, ways for family members or family friends to come and get that food and provide it to the children of that household. Corinne, anything on this scenario before I move forward?
Nope, that looks good.
The final scenario is a student or staff member or visitor on campus who they themselves have COVID-19. So that person would have either tested positive or been advised by their doctor that they're presumed to have COVID-19 regardless of their test results. In this scenario, we're going to ask that person, or we're going to ask the parent or the staff member to provide us the information on their C19 status. If the individual is presumed to have COVID-19, it would be great if we could talk to their medical provider. We're going to identify and notify students or staff who had close contact. We're first going to talk with public health, and we're going to assist them with the information that's necessary for identifying contacts. If there's any delay, we can move with caution we can take the precautionary step of starting to send people home and keeping them home while we get public health on board. We're going to keep those close contacts at home to quarantine and instruct them to contact their doctor for additional guidance. We're going to provide the self-isolation instructions. We're going to notify students and staff who had close contact, both by phone and by letter. We're going to provide those folks with quarantine instructions. And then we also have linked in the document an advisory notice that can be used for the campus as a whole, because rumors will be moving and you want to keep people based in facts. So everywhere you see bold in that column, there's a document that's linked for a template that's linked for your use. In terms of return to work, these folks can return to work 10 days after their last exposure to the C19 positive person. So if they're asymptomatic, they can return 10 days after their last exposure to the person that they may have gotten it from, and as long as they don't develop symptoms. Anyone who has symptoms and has tested positive for C19 should delay their return till 10 days after their symptoms began. Their symptoms must be improving, and they must be free of fever without using fever-reducing medication for the 24 hours before their return. Corinne, anything on that scenario?
Yes, could you clarify when they can return to work or to school? The first paragraph there, may return to work 10 days after their last exposure to C19 as long as they do not develop symptoms. Are these the people that were close contact with the positive?
No, these are people that are asymptomatic. So an asymptomatic person who's tested positive for COVID-19 isn't showing symptoms. And if they don't show symptoms at all for 10 days, then they can come back.
Thank you for that clarification.
Thanks for asking that question, because it's not real clear from the slide.
Yeah.
Alrighty. In terms of follow-up and tracking, we need to, for our symptomatic and close contacts, we need to stay in touch with them. So we're going to need to record the reason for why they've been excluded from school. We're going to need to report that information to the district's COVID-19 liaison, who's responsible for coordinating communication with public health. We need to update our screening list, because if there are people that we have said you can't come to school, we need to make sure that the people responsible for screening are making sure that they don't just suddenly show up. We will need to contact either the parent or the employee to update our information at least by the third date of that person's absence. We want to know what's happened. Has that symptomatic person or that close contact, have they now been identified with COVID-19? Because if they are, now we'll have a whole nother set of follow-up activities that we need to do. I've created something that I've called a potential C19 positive follow-up report. So this report, use it, don't use it, but please do take a look at it, because it will guide you through a number of questions that you need to consider as you're developing your own forms and tracking mechanisms. If the COVID-19 status of that person is undetermined, they still have symptoms, their test result hasn't come back, or they haven't gone to the doctor, then we need to continue to follow up until we know what's happening with that person. Have they developed COVID-19 or not? During the contacts, we should be reviewing the return to work and school criteria, updating our records, updating the COVID-19 liaison, arranging for continuity of learning and related services during the absence, really supporting, making sure that that child is well supported during that period of time. And then we should set tentative dates for return so people know how long they're going to be out, and then be sure that we've got follow-up mechanisms in place to ensure that that tentative date still works, that the person doesn't need to stay out longer than that tentative date. For people that have been identified as having COVID-19, we're going to still perform those steps in the box above this. But now we're going to also have to identify their close contacts and then do the same measures we talked about for each of those people. We also need to make sure that the district, charter, or private school COVID-19 liaison, whatever agency we work for, that our COVID-19 liaison has all of the information they need to work closely with public health to ensure that we're doing contact tracing effectively. So I like this slide because I think it's a good summary. The thing we really want to stress to you is that return to work is based only on the criteria that we've described so far. Um, return to work isn't allowed for any other circumstances. So if a person has a negative test result, that's not their ticket back to work. There is this scenario where if you have a PCR COVID viral negative, you can return 3 days after your symptoms have fully resolved. But sometimes what will happen is people who are close contacts will go get tested and say, see, I'm negative, I can return. No, a close contact needs to stay out for 14 days. So if it's not one of the criteria, if it doesn't meet a criteria that we've covered in this, then it isn't a way back. Negative test results never will supersede the criteria that we've described. Doctor's notes should not be required for return to work. Doctors are going to have a hard time keeping up with everything, and really the criteria that we've gone over with you have been established by the CDC and California Department of Public Health for return. There is no reason to require a doctor's note for return to work. Doctor's notes also don't supersede the criteria that we've covered with you. A doctor cannot say, this person doesn't have COVID-19, I'm confident of that, let them back in. The criteria are the criteria. Doctor's notes can be helpful with pre-existing chronic conditions. We want to remind you, if you're already aware of a pre-existing chronic condition and the symptom that you're seeing, symptom or symptoms you're seeing are consistent with that chronic condition, you and the parents both agree, then you can go ahead and disregard those symptoms. If there is a new condition that the school is not already aware of, then documentation from the medical provider is necessary to allow them to return to school or work. But we also want to be able to talk to that doctor. So getting an authorization to make sure that your school nurse can make that contact and confirm that it's a chronic condition, that's going to be required. Corinne, anything you want to add here?
Nope, that all sounds great, Bob.
In terms of information flow, if you're in a school district, you should have a COVID-19 liaison for your school district and for your school site. Chances are good frontline staff are going to be the first people to hear about the things that are on the bottom of that graphic. Frontline people like attendance clerks or teachers or instructional aides may be the first people to hear about possible COVID-19 cases or close contacts or people who have been identified as having COVID-19. School staff would report that to the COVID-19 liaison. That information would then go up to the district liaison, and the district liaison would handle communication with public health. If you're not in a district, the site liaison may be the person that has that contact with public health. Public Health Services is the agency that handles contact tracing. Our responsibility is to assist by providing them the information they need to do that effectively. We're the people that know who's in what class. We're the people that know who was on campus that day. So our records have to be good and we have to be able to help them effectively. The other thing I want to add is that school nurses are really going to play a critical role. They may end up as your COVID-19 liaison or site liaison, but school administrators really partner with your school nurse. Don't give them this responsibility to have and hold on their own. You need to become the COVID-19 or the COVID-19 prevention expert for your site. But your nurse is going to be able to offer you wonderful guidance and expertise. So work arm in arm with them as you take this on. Corinne, anything to add?
Nope, that sounds great.
So both the decision tree and the decision guide are available at these websites. As I said, the decision guide is probably a tool that your school nurse is going to find really useful. It's a quick reference guide for immediate decisions. For that more complete guidance that includes communication and follow-up, the decision guide is the document that you want to use. You can see the decision guide has hyperlinks throughout. That's to help save you time finding templates and instructions. If you have questions, honestly, Corinne's better than I am. So if you have questions about medical decision making, Corinne McCarthy is your best point of contact.
And I am happy to help in any way I can. And I do want to say too, the public health department has done such a wonderful job increasing the percentage of, case investigation, and that they respond very quickly. You're not alone in doing this, case investigation and close contact, investigation. There are people out there to help, and please use us. Yeah.
If you have questions about COVID-19 prevention plans or any of the guidance that's been issued by the California Department of Public Health or CDC or other agencies, and you'd like to run something past me, I'm also happy to talk with you. Thank you all for your attention.
Thank you.